Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. No? The main reason why I tried PPARS liquid, and it did well for the patient. No? It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella, diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda. Pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, gano'n. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Good day, everyone. Welcome to another episode of Simply Healed webinar. I'm Sheila, your host, and we're glad to have you with us today on a relatively new setup of our webinar. Today, we're diving into real science-based solutions for better health. Simply Nature PPARS supplements derived from a unique strain of microalgae are clinically tested to support cancer care, improve immunity, and help reverse chronic conditions like hypertension, diabetes, and high cholesterol. To quickly recap last week's webinar, we tackled a powerful topic, conquer cancer side effects. It was a very informative session with plenty of great questions well addressed by our experts. This week, we turn our focus on a deeply important theme close to my heart because tonight's topic is entitled Beating Cancer with Strength and Science. For the past 5 years, I've been part of Simply Nature family. I've also spent the last 4 years as a host of Simply Healed webinar, where I've spoken with hundreds of patients and families. But beyond my professional role, I'm also speaking to you today as a mother. In 2018, my son, who was just 4 years old at that time, was diagnosed with stage 4 rhabdomyosarcoma cancer. Now, this diagnosis shattered our world. The fear, the helplessness, the sleepless nights. I know exactly what many of you are feeling right now. But today, by God's grace, thank you, Lord, with the right support, my son is now 11, thriving, and continues to inspire us every day with his strength. That is why, as I've said, this topic is very close to my heart. Now, cancer is more common than many realize. According to World Health Organization, cancer was responsible for millions of deaths worldwide. The most diagnosed types include breast, lung, colorectal, prostate, and stomach cancer. But here's the thing. Also, according to World Health Organization, in their article last February 2025, they also said that many cancers can be cured if detected early and treated effectively. So here's the important truth. Millions of people also survive cancer every year. Treatments are improving. Science is advancing, and with the right mindset and support, many patients not only survive, but regain their health and quality of life. I understand the emotional storm you're in right now because I've been there. Questions like, will I survive? What's going to happen next? Will my child or loved one suffer too much? These are normal thoughts for every patient and caregiver. But let me tell you, you are stronger than you think, and there's always hope even on the darkest days. As someone who has worked closely with cancer patients and experienced this as a mother, I've seen how natural support can make a real difference, especially when used alongside medical treatments. And one area we focus here on Simply Nature is the PPAR protocol, a plant-based nutritional support approach that's designed to support the body at the cellular level. PPARS are peroxisome proliferator activated receptors, are special receptors inside your cells that help control inflammation, immune function, and cell repair and energy production. So, what does this mean for you or for your loved one going through cancer? It means the body has better chance to reduce treatment side effects, improve energy and appetite, strengthen immunity, even during chemotherapy and radiation. And because of this, I actually have seen this personally, not just with the people that we've have served here at Simply Nature, but most importantly, in my own son's journey. During his treatment, the Simply Nature PPAR protocol helped him recover faster, eat better, and maintain good energy levels. This is something that we want when we have started off with our cancer treatments. Now, to every patient, every caregiver, or every parent like me who are listening right now, I know the fear. I know the late night tears. If you need to cry, do so. But I also know the feeling of seeing a loved one survive and thrive after cancer. So there is hope, there are strategies, and most importantly, there are people like us here in Simply Nature to walk with you. The intention of today's webinar and onwards is to make sure that we answer more questions for all of you, for us to be able to empower you even more in your journeys. So, without further ado, let's dive right in. Leading tonight's discussion are two highly respected health experts. First off, it's an honor to introduce Dr. Jansen Lim, a graduate of St. Luke's College of Medicine and diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Joining him tonight is a successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International, our PPARS expert, straight from Singapore right now, Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Doc Jansen.
Good evening, Sheila. Okay, Doc Jansen's coming on. All right.
Hello.
Good evening, Doc. Okay, today we're doing a different format. We're just trying to jump straight into our Ask Me Anything segment. Thank you, Sheila, for sharing your story of your cancer journey with your son, Dominic. So, Sheila, let's jump right in.
Definitely. All right. So for our first question for tonight, okay, coming from Ms. Jhen, I'm a cancer patient. My friend introduced PPARS powder to me. She's just taking 2 scoops twice a day. Why is it that you're requiring me? Oh, okay. And here in Simply Nature, why is it that we are requiring some patients to take 3 scoops twice a day? What's the difference? I also saw testimonial from one of your cancer patients. She's also taking 2 scoops twice a day, and yet it helped her even in her chemotherapy.
Doc, you want to take this one?
Yes. Okay. So why are we recommending different doses? No, because people are different. Yeah, that's the main reason. Okay. How people respond to medications and supplements are very, very different. Okay. So my experience, sometimes 2 scoops twice a day doesn't even put the patient doesn't feel even anything. Okay. But when I increase the dose, then that's the time that the effect is more profound. The dosing is also dependent on the goals that the outcome that we want to have. Okay, so say for example, give an example from the comment itself. If the goal is just to help with chemotherapy side effects, then the dose will be less. But if you're not on chemotherapy, then the dose should be higher. Okay, and why am I recommending 3 scoops 3 times a day, or sometimes even 5 scoops twice a day? So for my other patients, no, why am I recommending that? Because that is almost the approximate equivalent of 1 vial of PPARS liquid. All right. However, here's the thing: we just derived that mathematically. Okay. In reality, it's not the case because the the preparation is different. One is in liquid form, the other one is in powder form. So converting will not be mathematically accurate. Okay, this is just a rough estimate that we did. All right, and this is not confirmed by the manufacturer. That's just me who did it. Okay, so with my judgment, no, as a doctor, that's what I will recommend for a specific patient. Okay, so each patient is unique. Then the dosing would be unique for each patient. Okay, even the type of PPARS that would be effective for you would also be unique for you. Okay, yeah. So hence the difference.
Wow, Doc. Actually, great question, Sheila, and thank you, Doc, for the answer. And it's a crazy serendipity or a crazy chance that I just in Taiwan on Monday right? Today I'm in Singapore, but on Monday I was in Taiwan. I was actually meeting up with a researcher, and he's actually from one of the big pharmaceutical companies. But when he retired at the age of 60, he retired and went back to Taiwan, and he started this research. And I think I mentioned to Doc in private that I was looking at a potential product for dementia, Alzheimer's, and Parkinson's. So I found it. And we were talking about it. And it's a single, again, like PPARS, it's a single ingredient product. And this one was actually extracted using a particular technology to break the cell wall so that the absorption rate is increased. Now, he was mentioning that there were two ways to do the preparation. One way was to actually break it in dry form, and then the other was to break it in liquid form. And actually, if you wanted to break it so that the absorption rate is 5 times more than normal, then you had to do it in the dry form. And what happened was that he said the final product is not the same. You're just breaking the cell wall, but the result that came from the process was actually different. There were different active components, and the results that came were again very different. So he was just sharing with me that this particular technology that they are using and for this product. So it goes back to, I want to use this new information from a scientific and research production process to support what Dr. Jansen has just said. You know, it is the same ingredient, it's the same component, but the concentration is done with a different method. So there is a liquid, for Simply Nature, there's a liquid extract, and there's the powder PPARS. And as Dr. Jansen said, we can increase the dosages so that it will come to the equivalency in terms of mathematically, right? That it is, you're reaching the same. But as Dr. Jansen would often prescribe liquid extract for all his cancer cases, there's a reason why. Because of the way the liquid extract was concentrated, its results and its functions and its benefits are different. And I can attest to that too, that there is a difference between taking liquid and PPARS, that powder that goes beyond just the mathematical equation. The process in itself has, I guess, also resulted in different benefit and functions of the product. It gets a little technical, a little too technical for our discussion, but I think that just gives us a glimpse of it. For the different dosages, Dr. Jansen answered it beautifully. It really is dependent on what you want to go for. And for Simply Nature PPARS, we've actually done an LD50 test. That is to test for any long-term toxicity. So this gives our doctors, like Dr. Jansen, the confidence to use and apply their medical insight, right, with great comfort that the product is safe, and which is why Dr. Jansen increases dosages for patients who are not getting the results that meet what his goal for his patients are. So that's another way to answer your question. So yeah, if you want, you are safe to increase your dosage to higher, you generally will get better results. Okay, but for you to really know specifically, why don't you make an appointment with Dr. Jansen so he can help you with the dosaging specific to your medical goals that you're setting out to achieve. Yeah, back to you, Sheila.
I agree. So, just want to reiterate, if for those of you who wish to have a consult with Dr. Jansen, just simply type in how to consult. Our HCS or healthcare specialist will get in touch with you individually. All right. Just before we go to our next question, I'd like to greet our viewers for tonight, starting off with Miss Jeanette Gu from Child House Manila. Thank you for watching. Also, Miss Edna Aveo, Miss Elena Antonio. We also have Miss Helen Kamunayan from Baguio. Hello po. Thank you for watching us tonight. Okay, for our next question, this was thrown to us also privately by one of our viewers. Quite aligned to our first question. Question is coming from Miss Alice. Can I use PPARS vial for my dad who has CKD?
Okay. The PPARS liquid That's not going to be the first thing that I'm gonna recommend for a CKD patient.
Same here.
Reason being is PPARS liquid has a higher potassium content compared to the others. So the safer one would be the powder because the powder is taken sublingual. So the extract goes directly inside to the blood vessels, no, inside your blood. So, however, no, for if your concern is safety, there are patients. So I have encountered CKD patients who are taking PPARS liquid. So there was one whom I encountered who was taking 2 vials a day. Patient did not. It didn't harm the patient. Potassium was stable, but yeah, it goes to show that for CKD patients, PPARS is still okay even at that quite high, very high concentrations. No, so from then on, we had to adjust. No, because the PPARS liquid was too over. It's overkill already for the what we want to get. So we had to make adjustments. At the end, the patient took powder and then eventually went on to just the tablets.
Wow. First of all, good news to all the viewers out there. Those of you who ask how long do you have to be on PPARS and do you always have to be on the liquid? So this Dr. Jansen just gave you a great example of how a patient, as the condition improved and changed the dosages and even the form of PPARS goes from the highly concentrated and of course more expensive liquid all the way down to our very basic product, the tablets. I also concur with Dr. Jansen. From our perspective also, right? We generally prescribe the powder for kidney patients simply because the liquid one does have more potassium. Again, the reason why we do this is many times kidney patients that buy our product, especially do not necessarily go for a consult with us, and hence we will definitely recommend the safest product that we can think of. So the better, safer one for a kidney patient, not that the liquid is dangerous, but the preferred one for kidney patients is the powder. Okay. However, as Dr. Johnson mentioned, there are times where, for example, you're fighting cancer, then yeah, go for the liquid, even though you may be a CKD patient, because the cancer, especially if it's a late stage, fourth stage cancer, that is more pressing than any other thing. So that the considerations will change. But in short, for kidney patients, yes, we recommend the powder. It should meet your needs as long as you're not in a critical condition that you need the liquid. Then the powder would definitely be our preferred choice for a CKD patient.
Excellent. Thank you. That's very encouraging for our CKD patient who asked that question. All right, for our next question coming from Ms. Kim K. If Cleansing Plus can make you lose weight, can the tablets alone also make you lose weight? Also, if the purpose is to lose weight,
okay, I'll take this one.
you'll drink it before lunch. Will it have the same effect if I drink it 2 hours before bedtime? I also have acid reflux.
Wait, what is this for?
Okay.
Yeah, go.
Yeah. A lot of questions, no? But okay, just to put it out here, if you want to lose weight, the best product to go for is Cleansing Plus because it's fiber. The tablets it has a minor effect on weight loss, but it's not the product to use. That's why Simply Nature did not market it for weight loss. It's why cleansing is the one to go for. Cleansing Plus. Now, PPARS Plus tablets, the tablets, no, it's still very important for you to take it if you're on the journey of losing weight because that's going to move your fats. It's improved fatty acid metabolism.
Yeah.
But here's the thing. It doesn't end there. It doesn't mean that you're burning more fat, then you'll lose weight. No, because if you're burning fat, but you're adding more fat, it's not going to do anything. It's not going to do anything. All right. So you have to do it all at the same time. So to lose weight, you have to burn more fat. How do you burn more fat? You have to move. Take your PPARS or take medications that help you burn fat. You have to reduce your caloric intake basically. Okay, because excess calories will become fat. Okay, so that's also reducing the intake. improving the quality of food that you're eating. Okay, so that's basically the gist of it. Simply put, but it's difficult to do. Of course, underlying diseases, if you have thyroid problems, medications that make you gain weight. So all of these things has to be taken into consideration. And has to be fixed, no, for you to be able to lose weight. Hormonal hormones as well, hormonal imbalances, those has to be corrected. So it's not just it's more there's more to it than that, no? So if I were you, if I'm going to choose only one product for losing weight, it's Cleansing Plus. But if you want to do it the right way, use both Cleansing Plus and the tablets. And don't just end there. You have to do more. Okay? I have to do more. Okay? So, yeah.
I just amazing, a great answer. I agree with you, Dr. Jansen. If there's a product you want to lose weight, Cleansing Plus is going to be so consistent. Doc, I always say that it's even possible if you're in this condition, you want, and this is really let's be a bit more details. You are someone who eats a lot and slightly irregular bowel movement or moderate bowel movements, and you're usually bloated, and then you have a class reunion in 3 days, and you just want to lose 1 or 2 inches from your waist. Okay, nothing is going to be more effective than the Cleansing Plus. Literally, you're just going to pull up the 1 or 2 inches that are due to just pardon my language, just crap stuck in your system, right? Just moving the bowels out is going to help you lose weight. A great example is if you go to Vikings and have a buffet, eat so much that you have to unbutton your belt, right? You have to unbutton your belt before you can go home. And then you want to lose weight. The next morning, if you pull, your waist goes back down, So this is just an example. Another thing that Dr. Jansen mentioned is so correct, right? It helps burn your fat. So what happens with a lot of patients who take the tablets for other reasons, for example, getting their metabolic syndromes under control, actually experience weight loss, right? And to the extent that they don't really change their diet, that means they're eating the same, all right? But again, those patients who are already decided to go on metabolic, they're on metabolic syndromes, are already watching what they eat, right? And then they don't really change much. They will experience weight loss. So the reason is, as what Dr. Jansen says, your body is burning more fat, and if you burn more fat, all right, you're gonna lose weight. But it doesn't help if you're not going to exercise, right? If you're not going to take some positive steps as well. So it's a great, how shall we say? It's a great booster for weight loss. So if you've decided to lose weight, okay, and you've decided I'm gonna walk, I'm gonna take brisk walk every evening, I'm gonna watch what I eat, then I would say the tablets is a wonderful booster to your weight loss too. Or like in a way, it will almost like guarantee that all these positive steps that you're taking to weight loss will actually create results that you can see and results that you can feel quickly. All right. So it's like if you're going to do all the right things to lose weight, then taking tablets is just going to help you achieve that in a much clearer way. And on top of that, if you take cleanse, definitely you're going to get the results that you want. Right. Yeah. And it's very, how shall we say? It's very economical. It's not like going to the very expensive weight loss centers. So you pay 2,000 pesos for every pound that you lose. And those are not really sustainable. Yeah. Sheila.
I just want to say, as per my observation with our online shops in our legit Lazada and Shopee, we always have this new buyer of Cleansing Plus, and it's always almost impossible for that buyer to purchase again. And I'm guessing it's because of the effectivity of having it as losing weight agent, right? So
yeah.
Also want to say thank you for Ms. Jocelyn for sharing an experience. Yes, my friend lost 5 pounds in 7 days. Get the Stay Stern package as well. Thank you for sharing.
Wonderful.
All right, so for our next question, very interesting, coming from Ms. Glenda from Oman with breast cancer. Is it prohibited for us patients to use perfume and skincare?
Okay.
The
I got the question.
breast
I got the
Yeah, I
cancer.
question.
think it's
Yeah.
breast cancer. All right.
Yeah. So this is I'm gonna answer this not just for cancer patients but for everybody, males and females. Um, if skincare or no personal care products no that has perfume, we tend to advise against it because perfumes, especially okay, the manufacturers don't indicate what kind of perfume they use. It's just perfume. Usually, if the products are cheap, okay, low cost products, the manufacturers use a substance use phthalates. Phthalates is spelled as PHLATES, phthalates. Okay, so the phthalates is a hormone disruptor. So it disrupts the balance of your hormones, and that causes it wreaks havoc to the balance of hormones in your body, which can sometimes contribute or increase your risk of developing cancer. Now, for breast cancer patients, this is more of a bad news, but this is there's no direct link between this. So this is just in theory, but no, but if you are a hormone receptor positive breast cancer patient or any cancer that has something to do with hormones, then using perfumes might worsen the cancer. Okay, so you have to be careful. So if you are someone, well, personal care products are part of our day-to-day lives. Buy products that doesn't have perfume, unscented products. This goes for soaps, your shampoos as well, deodorants, especially products that we tend to wear the whole day. So deodorants, makeup, what else? Lotion, skincare, moisturizers, sunscreen. So these things, be careful. Don't use any products that has the word perfume, parfum, or any along those lines. Now, here's an exception. If the scent that the manufacturers are using is essential oils based natural extract. So it's specifically written there. Lemon extract. So if you want to smell like lemon, everything. Yeah, just an example, then that's fine. That's okay to go. Or example, orange extract, for example. So you smell like orange. So that's perfectly fine to to wear. That won't cause any problems whatsoever because what they use it's an essential oil which was derived from the scent of the plant. No, so that's perfectly fine. You don't have to worry about pesticides with essential oils because essential oils, the way they manufacture it, I think they use some sort of distillation to produce the oil. So that's gonna be filtered out any bad or particulates, no? So yeah, that's the answer to the question. So be careful, everyone. Right? There are a lot of things that are inside our personal care products that actually causes harm in our body. Okay. So so since we're in this topic, no, another ingredient that you have to watch out for are parabens. Parabens, I still see them in the supermarket when I go there. Be careful. I won't mention any specific products because they are a lot. They are a lot. I happened to come into a well-known supermarket here in Manila. When one aisle is full of products with these harmful products. I won't mention the store, but they're prevalent. Yeah, they're quite prevalent. Um, I, I happened to use some of these products before. No, I didn't notice until this time around. So I'm trying to change a lot of our personal care items here at home. So yeah. Okay. By the way, you might think though that if I buy these products which are unscented with no parabens, it might be more expensive. Might be more expensive. Actually, no.
Oh.
They're not. They're almost the same price. It's just that those are way a little bit more expensive because way less people are buying them because of lack of marketing. So I hope this encourages, the manufacturers, the distributors of these products to bring more of these items out in the market. So, in order to bring down prices so more people can afford them. And of course, this is the healthier way to go. So, yeah, the choice, no, is actually common sense. Choose the healthier version.
Yeah, and this is the one I just I just thought it would be an interesting way to slip this one in, Doc. Because our extract liquid is some of our patients and clients don't like the taste and flavor. And many of them have asked me, why can't we make the product taste better? So believe it or not, guys, I've asked this question like 10 years ago, more than 10 years ago to my Ninong who invented the product. He's like an old, gruffy old man. He looks at me like, why? Why add anything? The thing is good, natural. It tastes, it is natural. That's why it tastes like that, but that's why it's effective. So no. We're not going to put any sugar and nonsense in there. So that's his reply also. But guys, sometimes we hear all these news about like parabens and all that, and then we sort of ignore them after a while. Like life goes back to normal, and then you walk by, and then there's your favorite soap with that very nice perfume smell, and you say you want to go use. You know what? You like the new detergents that are being or the what's that called? Fabric softeners. They're so smell so good, and you just like, oh, it can't be that bad, and you go back to using them, right? I just want to share with everyone that if we just look at something very simple, every year cancer rates are going up, right? So people can always say, yeah, people are also growing older, that's why we have higher cancer rates. But children getting cancer, the numbers are also growing up, and people are getting cancer younger as well. You could easily just correlate the time where people start getting more cancer is the people who are getting cancer earlier are the ones who started to eat fast food and processed food earlier also, right? And now these people are like me. I grew up when I was young. That's when McDonald's and all these fast food entered my country. So I'm the first generation that grew up on McDonald's. And in my generation, people are getting cancer younger than our parents' generation. So there is really an impact. In fact, one of the things that I've personally stopped using, maybe to the detriment of those around me, is deodorant, right? A lot of deodorants are full of chemicals and blocking your sweat glands. And yet we do that because we want to smell nice. So yeah, those are that's just like one simple thing that we all take for granted, especially in the Philippines. But yet that is something that's so harmful because we put it on every single day. All right. So if you really want, you should do some research and look for some natural ones like natural salts. My one of my mentors actually uses essential oil. He actually uses orange scented essential oil. So he is a he, okay, and don't read too much into this, okay? He smells like wonderful every time I'm near him because he has this aroma of orange because he has this essential oil that he uses all the time. So that's just one example. Yeah, but look, Doc, thank you for bringing that up.
Yeah.
It sounds like we have to give up and live like a hermit, and smell bad if we want to be healthy. But no, but it is, you can see the numbers of increasing illnesses and children being affected as well. So try to reduce what you can. Make a conscious choice, right? Yeah.
Right. Actually, one of our viewers in our YouTube live streaming is also asking, or maybe just a clarification, is are laundry soaps and fabric conditioners included in these products that we have to be safe from?
Very good
Sorry, I
question.
opened a can of worms.
And yes,
Very good
correct,
question.
yes.
The general answer is yes and no. Why? In general, fabric conditioners and laundry soaps are it has a lot of chemicals, which we don't know if they are carcinogenic or not. Okay. Um, Here's the thing. There are the more natural ones laundry soap and fabric conditioners, more natural ones, you can actually buy from Human Nature. However, they're way more expensive than the commercial ones. So I don't know if we're gonna use it long term, this would add to the budget of their grocery items. Okay. Because the price difference is really huge. Right.
Dramatic.
Now, now quality wise, quality is not gonna be as good as the commercial ones.
Yeah, this is
I'm gonna put this out there. I'm gonna put it out there. Yeah.
yeah.
So here's the thing, no. It's up to you on what you will cut out and what you would maintain or retain with your day-to-day use of these personal care items. Now, I'm not the expert to discuss this, no, because I'm a doctor. Um, you have to have a very good know-how of chemistry and psychology and biochemical engineering, biochemistry, no, to get a very good grasp of this. So I will suggest a YouTube channel. You can follow her. So the name is Dr. Yvonne Burkhardt. Her YouTube channel is the name is just Yvonne Burkhardt. So Yvonne is spelled out as Yvonne. Burkhardt is Burkart. Yvonne Burkhardt. So just search her. You can follow her. She is a PhD in toxicology.
Is it a KARD or T?
T.
T. Okay. I will
Yes.
type it up in the comments so that you guys can go and search her channel.
Thank you. Thank
Yeah.
you, Sir John.
I also follow her. So these advice that I gave you are all came from her. Okay. Yeah. So if you want to know more about these things, though, listen to her podcast, listen to her videos, watch her videos. Now it's impossible to be perfect. It's
Yeah,
impossible to be perfect. But at least you can make educated decisions on which to retain and which to cut out.
No, Doc, and just to related to this listener's question, this one I can attest that it does have impact. The fabric softener and detergent. The reason is this: my mom, every time I come back to Singapore, and if I stay at my sister's house, my mom will get involved with our laundry, right? And then she will always be angry. She will say, "You guys don't know how to wash your clothes properly. Don't you wash your clothes properly in Philippines?" My mom would say that. And then she'll do my laundry, right? And then when she does my laundry, my jeans will lose its color. It'll go like one lighter shade of blue after it. The amount of detergent and I don't know what she puts in there. Oh, it comes out cleaning, smelling like it's been under the UV ray or something like that. My clothes really smell totally sanitized. All right. But you know what? And they're very, very soft, super soft. So I assume she puts lots of detergent and lots of softener. But when I wear the clothes, I feel warm. My skin feels warm and a little bit prickly. All right. So I just, you read what you want into that. So I'm just saying that these chemicals do have an impact on us. So I would suggest, use them sparingly if you really must. All right. And I no longer let my mom. I try not to let my mom wash my clothes because they will all become bleached. But more importantly, actually, every time I wear them, I feel a bit warm. Doc, I also have this feeling when I when I bring my jacket to dry clean. Right, as y'all can see, I wear a round neck t-shirt. So it's actually just a t-shirt, right? So it's not like it's not like a normal business shirt where it goes all the way to your cuffs, right? So when I wear the jacket that is just dry clean, I also feel warm. I also feel like the parts that touch my skin, it makes me feel my neck, it makes me feel like warm. So guys, when you dry clean clothes, you don't actually use water and soap. They use chemicals to clean your jacket. So yes, to the viewer who asked about detergents and softeners, yeah, use them sparingly.
Thank you. What Doc Jansen actually shared is very generous. Thank you for sharing those, and even the YouTube channel vlogger. And I just want to say this is a very loud call out to all the mothers. So I guess this is also the answer for questions like, why is my kid's skin itchy always when they go out, or even
And maybe
in
they
the
will wash
house?
their clothes with more detergent because they want it to be clean, right? Yeah.
Actually, just want to, for the husbands out there, please be more patient with your wives, because I guess after this episode, your wives will take a little more time doing the groceries, reading the ingredients now. Okay, so there. So for our next question, coming from Miss Rain, I'm a patient of polycystic kidney disease. What PPAR should I take?
Okay, the answer here is complex, all right? First, you have to determine the inflammation. If the inflammation is high, go for the powder. If the inflammation is, quite low, manageable, then soft gel would be fine.
Very straightforward. Thank you. Sashan, next
Yep,
question.
Very
Okay.
good.
All right, next question, thrown to us privately. I saw that you also have a product for psoriasis patients. How can PPARS help me as a psoriasis patient? And should I also take together the PPARS Plus tablet and Cleansing Plus?
Okay, good question. For psoriasis, you have your immune system attacking your own body. So you have very high inflammation. That's a given. So to manage the flares of a psoriasis patient, you have to manage the gut. You have to treat the gut first. Detox number two. Number three, you have to manage the inflammation. So you have to use supplements that have very good antioxidant characteristics and properties. Okay, so I had a patient with psoriasis as well. She used PPARS liquid for a month. Flares went down really dramatically.
Wow.
Then I have to be honest here. The patient was not able to sustain the protocol because of the cost, no. But nevertheless, they still did it for 1 month just to get a dramatic improvement with this. Now she still has lesions, so but we're still treating her slowly. She's off steroids, by the way,
Wow,
and she
wonderful.
noticed. Yeah, that's the beauty of it. Because the steroids, she's quite frustrated with the steroids already. Because the steroids cause her a lot of problems. By the way, the patient is 28 years old, so
Wow, so young.
yeah, very very young. She had psoriasis ever since for at least 5 years now.
Wow.
If I remember correctly, since she was 23 or even younger than that.
I just want to
So
say
yeah,
you're doing something amazing, because for a young lady, I can just imagine psoriasis, how that affects her look and how she feels, affects her social life. So you have just not only healed someone physically, but also in their emotions. Yeah.
Oh, and just to answer the question further, right now what she's on is the tablets and the cleansing plus. Yes, so we've done a lot of detoxifications already on her. She's on a protocol. So right now she's just maintaining. So this is what she's on, the tablets and cleansing plus. Cleansing plus not even that regularly anymore because she's done with the
Regular.
intensive phase of detoxification. Yeah, so she's done. The cleansing plus is just there to feed her gut microbiota. Yeah.
I just want to focus on this a little bit more. I actually deal with doctors and a lot of patients that are psoriatic. My wife is actually a patient for eczema. So she's actually exhausted the steroid creams. And those of you who have actually seen my wife, she's very thin also. So you can also, so it's just a bad combination of using steroid creams for a long time and then being thin as well. So anyway, what happens is, I can attest to this, for most psoriatic and eczema patients, going on soft gel and tablets will give you amazing results, right? Will give you amazing results. And what Dr. Jansen did with his patient, that was, I would say, in a in a really bad state of psoriasis is absolutely how we would all do it here at Simply Nature, right? Because the fastest way to give results is to use the liquid extract. And as Dr. Johnson walked her through the most critical detoxification, and as you heard, the lesions were given a chance to recover and not to continuously break out in a very vicious cycle again and again. And now taking time to rehabilitate the body over time. So I want to share that I've had one doctor whose loved one, family member, actually so serious psoriasis that you would think that the person is actually a leprosy person. Whole body, like say, there's no part of his body that's not flaking. Okay, and the person the person was put on liquid extract, and then they went to Europe for a trip. So the person actually didn't have any breakouts, even though his food changed, right? And he, of course, ran out of the liquid somewhere, I think 2 weeks, right? 2 weeks into the 1 month vacation, family vacation in Europe. But guess what? They did have tablets, so they were able to sustain the maintain the improvement while they were there. So what Dr. Jansen did is just a good example, a good case study of what happens if you're eczema psoriasis patient. So if you're not super critical, if you're not, okay, here's another one. When I was about 15 years ago in region 5, if I'm not correct, it's region 5, there was a doctor who actually said something amazing. He just took tablets, but I think he took 20 tablets 2 times a day. After 3 days, he told the other doctor, the doctor that shared this product with him, that it was the first time in 14 years he was able to sleep properly throughout the night because he was suffering from extreme psoriasis, and it was just painful and difficult to even get one good night's sleep. I don't know how that is because I don't know, I didn't know, and I still don't know personally how bad it gets for a psoriasis patient, that it can be so uncomfortable. But the good news is that's actually what the feedback was. So yes, if you're a psoriatic patient, eczema patient, I would recommend the soft gel, just simply because it will be the stronger version and is economically, I mean, it's not that expensive. It's something that most people can afford. So do that for 1 month and then couple it, while you're taking the soft gel, still couple it with tablets. And I think usually after 1 month, the tablets will be able to sustain if you are just, mild eczema psoriasis. And within 3 months, you will see incredible results. Yeah, doc. Sorry, back to Sheila. Yeah.
Yeah, I just also want to quickly say that, with what Dr. Jansen did to his patient, it's really amazing because it's not like your typical topical solution. What Dr. Jansen did is that he solved it internally so that it won't keep
Not
coming back.
topical application, is actually correcting the actual flaw. Sheila, can you allow me to share screen?
Of course.
Okay, I'm doing it now. Guys, I just want to share, since that we talk about eczema and psoriasis, right? This is actually a case study where we worked with the National Skin Center, which is also the National Center for Disease and Control. I don't know why the two are together. In Singapore, it's the same thing. Okay, so this is the before after. These are psoriasis patients, and they have been using steroid creams for a long time, such that they must take a break from the steroid cream. You can't continuously use steroids, all right? So this took 3 months, and this is to be specific, these were, of course, clinical trial patients, so they were on 60 micro tablets. We just said normally it's 20 to 30 micro tablets, but these took 60, which you don't have to take so many if you take the soft gel capsule, right? Okay, so that's why we recommend that. So you can take a look, 3 months, look at the vast improvement. They say a picture is worth 1,000 words. So here's a good example to that viewer. I hope when you see this picture, I hope number one that your psoriasis or eczema is not so bad, right? I can empathize, but you can see the improvement in the patient's skin, right? Just 3 months, no other protocol, mono protocol, just the tablets alone. And of course, they also did the pain scores, so the joint pains and everything went down as well. So back to the other. I just hope that little presentation is encouraging and gives you hope. And please contact us or have an appointment with Dr. Jansen so that you can get a hold over your battle with eczema and psoriasis.
Yes, for those of you who wish to have a consult, simply type in how to consult. Our caring HTS will get in touch with you individually. All right, another question, interesting one, coming from Mr. Albert. What are the home remedies for sciatica? Also,
Wow.
a follow-up one, what are the other conditions that resemble sciatica, and what's the definitive test to do?
Okay, sciatica is a condition wherein there is a shooting or electric-like sensation that radiates from your back or your hip down towards your legs to your foot. So that's sciatica. So the main problem for sciatica is nerve impingement. So you have to fix the nerve impingement to really resolve the sciatica. Okay, that's a definitive one. So reasons why you can have sciatica can range from, having impingement in your spine. You can have muscle spasm. Muscle spasms are, your muscles are contracted such that it squeezes the nerve in between. So the manifestation would be um, sciatica. Okay, so some home remedies that you can do, try warm compress. Okay, so that should soften the muscles. Medications that you can take would be muscle relaxants, vitamin D complex, but the vitamin D complex is just gonna do a little bit, no, not that much. Ultimately, it should be the muscle relaxants. If you're asking natural remedies, then I don't know the answer. I'm not the person to ask. No, you have to ask someone who's trained in TCM. I think that would be the perfect person to ask. Acupuncture can also do a lot for sciatica. Yeah, prolozone as well, to help relax the muscle, because ozone therapy can help manage the pain, no? Help reduce the inflammation around the areas. So I hope I was able to answer the question. No? So those are the things that you can consider.
Yeah, those of you who are interested in acupuncture, make sure you get a fully licensed one. And not to say anything, actually, if you meet a TCM doctor in Philippines, who is from China, you have a better bet. I say this because in Philippines there are many acupuncture, what's that called? Training programs, right? And they vary in their depth. I know of programs where 3 to 6 months and you are already a practicing acupuncturist. The program that I went to required me to do 2 years before you will even get a certification. So I did not finish that program. just to just to be just to be clear. But so that there's very varying levels of training, because this is not actually controlled by DOH. There is some inconsistency. So do a bit more research when you want to, or don't give up. Or if the acupuncturist you see couldn't solve your problem, maybe look around a bit more, do a bit more research, ask more people, and you can find. I'm sure you'll find a good and very qualified one. There are many in Philippines. Yeah.
Thank you, Dr. Jansen. Thank you, Sir Shyan. Another question thrown to us privately coming from Miss Elizabeth. I feel healthy right now, but is there a basic lab test to generally check for cancer? No family history, no, not smoking, not drinking alcohol, just want to feel secured. Wow, I love this
This
question.
is a
Yeah.
proactive person.
So if you ask a doctor who doesn't know RGCC, then the answer would be to test for every single tumor marker. But tumor markers cannot be used as a screening tool, because there are a lot of things that can elevate tumor markers, because they're very non-specific, especially for a person who doesn't have family history. and no history of cancer diagnosis. So tumor markers is a no-go for me. You can go for imaging studies, but you don't. If you are someone who doesn't have a history of cancer, then chances are nothing's gonna show up on the imaging. However, if you are in that age wherein you need to, for example, for breast cancer, for women aged 40 and up, you have to go for your annual mammograms and breast ultrasound. Then that's a good way to catch as well. But if you want to be more accurate, no, if you want to look into your immune system, is it fighting cancer already? Then the answer to that is OncoDeclare. So RGCC is the lab to test, no, to go for to have OncoDeclare, to have the OncoDeclare test. So for OncoDeclare, what we are measuring there is, or what the question that we want to answer is your immune system expressing genes that expressing genes to fight cancer? Because if that is positive, then your immune
Fighting
system
cancer.
already has weapons for cancer. Okay, it's already showing the weapons, right? So at that point, yeah, your body is trying to fight cancer anymore. So if that is positive, then I would recommend more testing at that point. So I would look into your PET CT scan. I would look into your if there are any circulating tumor cells, no, circulating in your body. So that is if you have a positive OncoDeclare test. Okay, so that's the test to go for.
So for this particular viewer, you're so proactive. I would suggest if you want to know more about the OncoDeclare, just schedule a quick appointment with Dr. Jansen. All right, and then he'll guide you and direct you to the right place where you can actually have this OncoDeclare testing. Again, I really applaud you for being so proactive about it, and I'm also like you. Although I'm not so afraid of I'm not afraid of cancer, maybe because I'm in Simply Nature, and I have unlimited access to Simply Nature Pipa liquid. All right, so that's not my concern. My concern is actually like dementia and Alzheimer's. So doc, so okay. Number one, let me stay on topic. Okay. You asked the question, so I think here I wanted to add to this is that, many times on our program, people ask us what can we do to take anti-cancer steps in our life, right? So number one, getting all your comorbidities under control is one of the biggest anti-cancer things you can do. Okay, there isn't something that you can specifically choke or anti-breast cancer specifically like that. There's nothing you can take to prevent a specific cancer. What you can do is to make all cancers difficult to find, to establish themselves in your body, or you delay that process. Okay, so how can you do that? The key one is reduce chronic inflammation in your body. Make sure you don't have comorbidities, the common ones, the metabolic syndromes, which include your blood cholesterol, blood sugar, hypertension. All these are really one of the key factors that create. It's like the soil, the water, the fertilizer, and then all you need is to throw the seed of cancer, into that mix, and that's where your cancer comes. So if you take the seed of cancer and you throw it on the ground, but there is no water, the ground is so dry, there is no nutrients for the seed to take, then the cancer seed cannot manifest. This is what we would also term as epigenetics, right? So you can actually trigger or de-trigger a gene in your body based on the conditions of your body. So the thing that you can do to make yourself anti-cancer or prevent cancer from taking root is take good care of your body, make sure you don't have inflammation and you have no comorbidities. That will already put you in a very good state to not develop cancer. Okay, I just want to digress a little bit. So I did tell Dr. Jansen, I think last week, I told the program, I'm going to Taiwan and I'm going to try out this Alzheimer's, dementia one. I just want to take the opportunity. I'm so excited. Just like Dr. Jansen when he did his program, I'm so excited to share. Okay, so here's the interesting doc. I sat down with the researcher. He explained to me what he has, right? The difficulty with treating dementia, Alzheimer's, is that even psychotropic drugs or the treatments that deal with that has the problem is very few drugs can cross the brain-blood membrane. And that's why once you are onset with dementia or Alzheimer's, there are not many things that can be done because it's difficult to cross that barrier. So to everyone who's listening, it's basically your brain has like a protective membrane that stops a lot of any chemical that's not supposed to be there to go through. So that also means that once you get a brain disease, very few drugs can penetrate this and affect your brain, right? So then you can't really treat it because nothing can penetrate it. So there's this particular natural extract that can and it's actually a neural growth factor, and it's NGF. So it will actually increase dopamine production and lots of other technical stuff. So you know what? The first thing I did, Doc, I've been having this lack of sleep problem for 3 years. 3 years, and lately I've been feeling a little bit of brain fog, and I logical conclusion says you can't sleep 4 hours for 3 years and not have it affect your freaking brain, right? So yeah, I'm on it. And the first night I'm on it, and I again, like as usual, slept 4.5 hours only. But the next day I woke up, there was actually significantly less brain fog, and there was a lightness, a clarity, and I'm not so tired. So now I'm only on my 3rd day on it. So it's looking good. I'll pass you the science. To anyone, I'm sure to Dr. Jansen, this is very exciting also, because anybody who values their intelligence, and Dr. Jansen is a good example of a very intelligent person. His identity is definitely keyed into his intelligence, and if he loses it, it's a huge blow to his id and ego. Okay, so yeah, for me also. So I'm just sharing. Yeah, so there are things that we can do to actually so how does this tie back to the question about how to be anti-cancer? So this particular thing that I'm taking is not like specifically anti-dementia, anti-Alzheimer's, but we actually deal with the root cause, right? We deal with the root cause. Actually, this nutrition that I'm taking is actually able to penetrate the blood-brain membrane and to be able to promote NGF, neural growth factor. So it will actually allow the brain to produce a healthier volume of dopamine, and that will just help with the brain chemistry in addition to other factors. So just like how do we anti-cancer, lower your inflammation, get your blood sugar, blood cholesterol, all this under control, and you are actually fighting cancer or preventing yourself from developing cancer. All right, Sheila.
Amazing.
Maybe just one more question.
Yes. Well, let's try to answer 3 more questions lined up tonight.
Okay.
Still have a few more time. Okay, so the question is, I'm taking Furbith D3 for almost a month. I just have a blood test taken. The result of vitamin D is high, 56.2 ng/milligram. The reference range is 8.95 to 46.5. My question is, should I stop temporarily taking the Purevit D3? This is coming from Miss Mai.
The answer is you should not. Why? Because your vitamin D3 is actually in the optimal level range. The optimal level range of vitamin D3 is between 50 to 70 nanograms per ml. So, we doctors do not read the reference range. It's not a part of our analysis.
Okay.
So,
very straightforward.
you as a patient, what you have to focus on is the advice that your doctor gives you, not the laboratory, because the laboratory is meant for doctors to analyze. Okay, and mind you, not all doctors also know how to analyze this. So you have to go to the right doctor. Okay? 56.2 nanogram per ml is actually in the optimal range if you are someone who is healthy. You don't have autoimmune disease, you don't have cancer, you don't have any disease related to allergies, then that's perfectly fine. Okay? So keep it up, just maintain on it. You should be fine. By the way, vitamin D3 is named as a vitamin for a reason. Without it, we will die.
Wow.
Okay?
Wow.
Vitamin D3 is very important for longevity. It's an anti-aging molecule. So
Wow.
stay on it. Stay on it. There are a lot of diseases that occurs because of lack of vitamin D3.
Wow.
Actually, nowadays, no, there are a lot of people who have vitamin D3 deficiency because of simply has vitamin D3 resistance, or because they're too afraid of the sun.
Yeah.
Or
Yeah.
they don't
Yeah.
have a choice because they're working in an office.
Yeah.
So lack of sunlight. Stay
Yeah.
on it. Stay on it. Okay. So 56.2 is perfectly okay.
Yeah, even my sister was diagnosed. She was like chronically fatigued, and when she finally went to see a doctor and get a test, she was vitamin D deficient. So there you go, guys.
Getting more and more common nowadays. Okay. All right. Thank you, Doc. Thank you, Sir Shine. Right. Next question coming from Ms. Minda Banela. How can PPARS help to hypodense mass measuring 0.53 centimeters?
Okay. Okay. That's okay. The comment that I mentioned a few minutes ago is the same for here, no? For this one. Hypodense mass is a CT scan finding. Okay, hypodense just means that the mass is less dense compared to its surrounding environment. What it is, we don't know.
Yep. Yep. Yep.
What it is, we don't know. Is it cancer? Maybe, maybe not. Okay, because yeah, it's just a description, a CT scan characteristic. So more information has to be. I need more information to know if PPARS would help or not. But the answer, if PPARS would help you as a patient, then yes,
Yeah.
because it can, it can make you healthier, right? It's a health food. So the answer, if it will benefit you as a patient, yes. Will it do something to the mass? I don't know.
We don't know because we don't know what it is.
Yeah, we
Because
don't
we
know what
don't
it
know what
is,
it
and
is.
I don't. Yeah, and I don't know your whole story. So if you really, I'm kind of committed to this. Yeah, schedule a consult, and we'll see.
Yep. All right. So what you can do to start is schedule a consult with Doc Jansen. So that number one, I know, Doc, I realize something. Many patients here are giving us or asking you what their diagnostics is. So I have one simple conclusion. They feel more comfortable talking to you than
Oh,
to
yes.
their existing doctor, right? So to this particular, to Ms. Minda, obviously, you're comfortable asking Dr. Jansen questions, which is why you type a question in. Then may I humbly just suggest to you, then it seems like he is an ideal physician for you, because what every patient needs to be able to do is to be comfortable asking their doctor their questions, all right? So that you understand what's happening to you and what kind of treatment you're going for, all right? So there.
Yes,
Last
I've seen how Doc Jansen does his consults. He's very meticulous. He digs deeper into the medications you're taking, supplements you're taking to give you the best recommendation. So for those of you, just simply type in how to consult. Our HCS will get in touch with you. Okay. All right. So our last question for tonight.
Last question. All right.
Okay. For coming from Ms. Ritz Melendez, is there any other way to make the breast lump that has spread to armpit smaller aside from chemotherapy?
Okay.
Yeah. You have radiation therapy, you have targeted therapy, immunotherapy. So that's the conventional side of things. On my side of things, you have high dose vitamin C, you have artesunate, you have mistletoe therapy, ivermectin, mebendazole. Those things I also use. So yeah, there are options which we can tap into. Also, another one is the PPARS liquid itself. No? PPARS liquid has been shown to induce cancer cell death, no? So yeah, those are the things. Now, since this is cancer, no, for cancer, you should not only rely on a single product. Okay, you have to use a combination.
Yep.
Always a combination. Best outcomes usually come out if we use a combination of different products to address the issue. Reason being is because cancer has 14 hallmarks. It means that there are 14 things that makes cancer what it is. Okay? So we have to address those 14 things. So it cannot be addressed by a singular product or treatment. Okay?
Yeah, I just want to how shall we say affirm what Dr. Jansen has said. There are many approaches to treating cancer, and yeah, it's a perfect example again. If you're asking Dr. Jansen this question, he might be the ideal physician for you. So why don't you schedule a consult with him? Yeah.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Well, it looks like we've have covered all the questions tonight. As we wrap up this evening, we'd love to hear your final thoughts for our viewers tonight. Who would like to start off? Dr. Jansen?
Yeah, I'll go first. So it's really fun though doing this every single week. Even though, me and
Sometimes it gets
Sir Shyan
tiring.
and Sheila are sometimes we're really tired though working the whole day, but this is the reason why we keep doing what we're doing. It's to help you guys and see you get well. Of course, it won't be perfect, yeah, because we're not, Jesus Christ. We're not the Lord, right? I mean, we're human. But it's always nice to be an instrument of the Lord, no, to do His work. So, guys, don't lose hope. There's always something we can do, and you just have to keep on fighting. Now, I'm not saying this to give you guys false hope, no. This is to change your attitude towards life itself. Okay. Um, yeah. So that would be my parting words for tonight, and I hope this helped a lot of you guys, no, in making your decisions and clarifying things. If you want to clarify more things, then there's always a next week. We're here every single week, and if you want more help, then you have to pay for already. Just kidding. No, just kidding. You have to set a consultation already, so I can know more about your story. Okay, so I can help you better. All right. So that's it, guys. Thank you and good night. I'll give the floor to Sir Shan.
Thank you, Dr. Jansen.
Jansen.
Again, Dr. Jansen has voiced everything in my heart as well. So thank you for your questions. I just saw that Ritz had a follow-up question. He said, where to avail ivermectin? So again, ivermectin is actually a drug. So when it comes to any drug, I would straight away want to advise you seek a doctor's consult. Okay, all drugs should be used under the supervision and advice of a doctor. The reason is all drugs are essentially poisons. I know that's a very strong word, but no healthy person will eat a drug, right? No healthy person without cancer will take chemotherapy. So for that, I'm just making it very serious so that you don't try to self-medicate. I know in Philippines, many of us are familiar with many drugs, but don't self-medicate. At the very least, start with a good consult so that you're clear on the parameters or the guidelines for any drugs you're interested in using. Okay, so with that, I want to once again thank everybody. I hope that you've learned a lot tonight, and we'll be back here answering your questions again next Thursday. And I'll be doing that not from Singapore, but from Philippines next week. All right, thank you. I'll hand the time back to Sheila.
Thank you, Sir Shyan. Thank you, Dr. Jansen. On behalf of our patients and viewers tonight, once again, thank you so much, Sir Shyan and Dr. Jansen Kalalan, for answering our questions. Now, if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and Dr. Jansen Kalalan's Facebook page. Simply Healed Medical Group, and subscribe to our YouTube channel. This is also to make sure that you are always updated with our latest promos and events. Now get ready for the best deals ever, because this you must not miss, the pre-price adjustment promos. Buy one PPARS liquid extract and get two PPARS plus tablet and get one free bottle of PPARS Plus tablet worth 2,000 pesos. And also buy one PPARS powder extract and two PPARS Plus tablet and get free bottle of PPARS Plus tablet worth 2,000. Another one exciting is buy worth 10,000 of PPARS soft gel capsule or PPARS Plus tablet or tablets or Cleansing Plus and get 3 sachets of Cleansing Plus. Now, these exclusive promos are running up until July 14, 2025 only. So this is available via direct and via our website, www.simplynature.ph. So now is the time to prioritize your health and your family's well-being. Experience the proven benefits of PPARS at an unbeatable price. Once again, thank you for spending your time with us today. We hope to see you next week. That's happening on July 10, Thursday. This is once again, same day, same time, every Thursday night at 7:30 p.m. Your commitment to healing and recovery inspires us. Remember, every step you take is a step forward, and you don't have to walk this journey alone. This is once again Simply Healed webinar powered by SMG and SNI, because your curiosity about your health condition and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.